A cough is one of the most common symptoms in medicine, but inside the body, it is an impressive and highly coordinated defense mechanism. It all starts with an irritant. This may be something simple like dust, perfume, smoke, or cold air. It may also be mucus buildup, stomach acid from reflux, or infections such as influenza, COVID-19, or pneumonia. Any of these can disturb the lining of the airways. The airways contain special receptors located in the throat, larynx, trachea, and bronchi. These receptors constantly monitor the airway environment. When they detect irritation, they immediately activate and send a signal along the vagus nerve to a special area in the brainstem known as the cough center. Once the brain receives the message, it evaluates the threat. If the airway needs to be cleared, the brain sends rapid commands through motor nerves to the respiratory muscles. These include the diaphragm, intercostal muscles between the ribs, abdominal muscles, and small muscles controlling the larynx. The cough reflex has three phases. First, the body takes a deep breath to fill the lungs with air. Second, the vocal cords and airway close tightly, trapping the air inside. Third, all of the respiratory and abdominal muscles contract strongly. This suddenly forces open the airway and expels the trapped air at extremely high speeds, often reaching 70 to 100 miles per hour. That blast of air removes the irritant, whether it is mucus, dust, or harmful microorganisms. In many cases, coughing is a useful reflex, but if the irritation continues for weeks, the body may cough even when the airway is clear, leading to chronic cough. Causes can range from infections and allergies to chronic lung diseases such as asthma or COPD, and even medications like ACE inhibitors used for blood pressure. So, a cough may sound simple, but it represents a powerful protective reflex connecting the lungs, nerves, muscles, and brain to keep the airways clean and you breathing freely.